Good morning. I am Donna with Aging Advantage, and I'm here today again with another educational opportunity so that we can make connections with local resources that could help with food, housing, or isolation struggles post-pandemic. And today, our speaker, we're going to let Beth, she's our speaker for today. She's going to go ahead and introduce herself, and she'll tell you more about what she has to offer. Go ahead, Beth. Thank you.
Hi, everybody. I'm Beth Hall. I'm with Apex Network Physical Therapy, and we're going to talk a little bit about fall prevention and balance and all of those good things. So I am going to share my screen with you here so you can see my PowerPoint. So this is what we'll be talking about. Donna, are you able to see that just to be sure?
Yes, I can see it.
All right, perfect.
Thank you.
So we'll skip through this little PowerPoint presentation, and I'm going to switch to the slideshow version here. It's a little bit easier to see. There you guys go. So our balance program with Apex is called Age Strong. And obvious things, we're trying to make sure that we're assisting everyone in our community and using, research and all the evidence in how we approach it. And so with that, just to kind of give you a little bit of an idea on the prevalence of falls, more than 1 out of 4 adults of the age of 65 years or older falls each year. So about 34 million older adults fell in 2018, which amounts to every second of every day an older adult is falling. So nearly 3 million elderly adults are treated in the emergency departments each year for falls or injuries related to falls. And falling once doubles your chances of falling again. And fewer than half of the individuals tell their doctors. And a lot of that is because they're worried about losing their independence. They worry that their doctor might take their driver's license away, or that their families will find out and not trust them to live at home independently. So they tend to tell us therapists, though, because we spend more time with them. Usually we're seeing patients 2 or 3 times a week. So we get a little more information from our patients than the doctors do in their 10 or 15-minute visit with them. But a growing problem with an aging population. So, we have the baby boomer generation hitting healthcare now. And so a lot more people are over the age of 65 than in the previous generations because of the size of that generation. So just to kind of give you some ideas about how significant falls can become, though, the death rate from fall injuries has increased by about 30% in the last decade. So over 10,000 people in the U.S. turn 65 every day. And with the growth of the elderly population, we continue if we continue at the same frequency of falls, by 2030, there will be over 52 million falls a year and 12 million injuries in the US. So you can see these little pyramids here show us that. And there are some common misconceptions. So the falsehoods are falling or the added risk is just a part of aging. So that's not true. You should take additional precautions. So you don't have to completely alter or refrain from physical activity. You just have to take precautions to avoid the fall risk. Another falsehood is I should limit my activity that puts me at risk for falling. Less activity is going to amount to less strength, and then it's kind of just a vicious cycle from there. So you end up with less strength, then less stability, and less mobility then essentially. So one feeds the other. So we're going to talk about how to move safely and be active safely versus having less activity. That's not what we want for our patients. Another falsehood, the individual seeking help is a burden by asking for assistance. That is absolutely not true either. By seeking help, you become less of a burden. So versus more of a burden. So being proactive and taking steps to prevent a fall is the best approach for everybody involved, your family, your friends, caregivers. And then fall prevention programs are expensive. That is also false. Injuries, hospital bills, etc., all those things that you incur from a fall are 10 times more expensive than the fall prevention. And your insurance, for the most part, will pay for balance programs for physical therapy. So some of you may have Medicare, but all of the insurances, including Medicare, pay for physical therapy for balance and strengthening. So just to kind of frame it up here, when an elderly individual falls or becomes fearful of falling, they become more sedentary, they become weaker, they lose mobility, they become more isolated, and they have a greater incidence of depression. So all of which lead to an even greater risk of falling. So how do we break the cycle? You're part of that puzzle. And so as I said earlier, our fall prevention program is called Age Strong, and it's PT directed and research supported. So we complete a fall risk examination and a balanced treatment program. It's proven to be effective at reducing falls, and it's incorporated into the entire physical therapy examination. We progress the patients as they are able, and we try to make them as independent with those activities with an ongoing home routine also. We do ongoing assessment also, just to kind of reevaluate your progress and how you're doing, hopefully progressing, not regressing. So our goal for all of you is helping enable the population to continue being active and independent. So we want to either regain the independence or, remain independent. And that can be, with whatever situation you're in now. So you might be completely independent at home. You might be in an independent living with some assistance, or even in an assisted living. But in any of those scenarios, we certainly don't want to get worse, right? So we at least want to maintain. And sometimes we can improve and get better. So we want you to be able to perform your activities of daily living without the worry of falling. And we like to educate everybody on the statistics so that you realize you're not alone, like those statistics that we just talked about. And we also want to make sure that you realize that falling doesn't just have to be a part of getting older. When we talk about the evidence and research, kind of the sweet spot for exercise and for this program is about 50 hours of exercise related to balance and strength within a 4 to 6 month period. And with that, we can see up to a 30 to 40% reduction in falls. So it's fairly significant just by participating in some program. Doesn't even have to be our program, but getting active and having someone focus those activities or exercises on balance. And so seeking that outside support is going to be super important to improving your quality of life and requiring, hopefully less assistance from caregivers and family members. So just to kind of give you a little bit of an idea on how we balance, what is involved in balance. I always think it helps to understand it first. So what does our balance require? First of all, it requires vision. And so making sure that you're wearing your glasses or your contacts, that's going to be important. Making sure that the lighting is adequate so that you can see your surroundings. And then a big part of it is the receptors or sensory receptors in your foot and ankle. So when that foot hits the ground, it needs to be able to accommodate to whatever the surface is. Sometimes it's just a nice level flat surface. And sometimes it's irregular surfaces, like if you were walking across a yard or on gravel or something like that. But either way, that the receptors in the foot and ankle fire, and they send information to the brain about where your body is in space so that we can make adjustments accordingly so we don't fall. And then there's a little bit of our ear that's involved also, and it's the middle ear. So if you're looking at the ear here, so we've got the eardrum right here in this section. And then we've got these little semicircular canals here in the middle ear. And those are fluid filled, and they have these little hair cells within them that project up from the bottom or the basement of that canal. And those hair cells are displaced from side to side whenever our head turns. And so our ear gives our brain feedback as to where we are in space also. There is a condition called vertigo, and vertigo is caused by these little crystals that are in the ceiling of that canal falling down into the canal and bumping into these hair cells, causing them to give inaccurate feedback to the brain. And so vertigo, some of you may have experienced this before, but it's dizziness or feeling like the room is spinning or floating. Typically, I'll have my patients say that it's worst when they roll over in bed, or like if they bend over to tie their shoes, in that head down position. Typically, these folks have a history of motion sensitivity. So you might have been the person who, when you rode in the car, you couldn't read a book, or you needed to ride in the front seat instead of the back seat, or else you'd be sick. And they may have even had a history of concussions or migraines, those kinds of things in their background. So you can seek physical therapy strictly for that also. There's a technique called an Epley maneuver that we use to treat vertigo specifically. And there are several medications out there too. The most common one is meclizine. So you may have been prescribed that in the past. And then your provider, if you do have episodic or recurrent vertigo, your doctor will tell you to do things like start a low sodium diet. Other things could include staying on an antihistamine. So that will help with any of those seasonal allergy sorts of flare-ups, because it does tend to be episodic, and it does tend to recur during those times of year specifically. So then talking about what you can do. So we know how we balance now. We know a little bit about the Age Strong program. So I want to speak to what that involves. So we do testing, we do treatment, and then we hopefully do some prevention also. The testing is going to be a full evaluation. So we're going to look at the musculoskeletal system, so your strength, your flexibility, your range of motion, and of course then your balance too. So to give you an idea what the balance balance test might look like, one of the tests is a 30-second sit to stand. And so we're going to see how many times our patient can move from sitting to standing in a 30-second period. And you can see down here, there are some norms for your age and whether you're male or female as to how many times you should be able to get up and down from that chair in that 30-second period. So we compare your scores then to the norms. Whoops. And then we recheck that every so often also to see how you're improving, if you're getting closer to the norms for your age. Another test is called the tug, or the timed up and go. And we want to see how quickly you can walk 10 feet and back. And it should be, if you're at a low risk for falls, it should be at less than 12 seconds or equal to. So we'll check that with you guys. And then we also have a 4-stage balance. So we're going to see how you do with standing with your feet really close together. We're going to see how you do standing with your feet staggered. And then the next progression from that is standing in tandem, which is kind of like standing on a tightrope. And then we'll also check how you do with single leg stance. And so we want to see most of our adults, if they're unable to hold tandem stance for less than 10 seconds, then that's a pretty good indicator of fall risk also. One other thing that we check as a part of the evaluation is blood pressure. And sometimes we'll see that someone's blood pressure will change fairly dramatically whenever they move from sitting to standing. So we'll check it whenever you're seated, and then we check it again as you move to standing. And sometimes with that significant drop in blood pressure, you'll notice some dizziness. So teaching patients then to, pause before you start taking steps, right? So you want to make sure that that momentary dizziness dissipates before you start walking to reduce your fall risk with that. And sometimes it's medication related. So if we do find that that's a significant problem for that particular patient, we can also, have a conversation with their primary care provider or their cardiologist about what we're seeing, and they may be able to make some medication adjustments to help eliminate some or reduce some of that dizziness too. And then, so that was our testing. And then we want to talk just a little bit about our balance and strength training program. So looks like a lot of different things. So our treatment programs always involve a little bit of a warm-up. So we might put you on the bike for a little while or the treadmill. You might just walk within the clinic. And then we're going to do some full body stretches because if we're stiff, we're also more likely to fall. So we want to loosen up a little bit. And we'll start working on endurance types of activities because if you fatigue quickly, as you fatigue, you're more likely to fall also. So we'll start working on increasing your repetitions, reducing rest periods, and then lengthening the sessions as you improve. And then, of course, focusing on strength. So strength, particularly at the foot and ankle and at the hip. So we have two types of balance strategies. There's a hip strategy and an ankle strategy. And so what we see in toddlers is a hip strategy, and you'll see them kind of move their hips around. It almost looks like they're doing the hula in order to try and keep their stability. But as we become an adult, we should move from that hip strategy, not that we can't use it if we need it, but we should start to use an ankle strategy. So if you were to push me, the first thing that should happen is my toes should lift up off the ground a little bit, and I use my ankle to help pull myself forward to keep from falling backward. And so we focus a lot on hip and ankle strength to help bolster both of those strategies, both the hip strategy and the ankle strategy. And then of course, beyond strengthening, we're working on balance and gait. So we have lots of fun exercises that we use for balance. And like I said, it's a tapered program. So we first work on ramping things up, and then we can kind of taper down as our patients improve. So we start out 2 to 3 times a week. And then as we see improvement and reduced risk for falls, then we reduce to 1 to 2 times a week. But typically, like I said, most of our hours, that 50 hours needs to occur within a 4 to 6 month period. And that 50 hours can include things you're doing in the clinic with us, but it's also going to include the exercise you're doing at home. So we give you a little tracking tool so that you can make sure that we're getting to that 50-hour mark within that time period. And if we see that, after you stop our program, you start to get worse, we retest you, you give us a call, we retest you, and then we can resume PT if we need to for a period of time again. We talk about chronic conditions and we talk about things like Parkinson's, and those are progressive conditions. Well, if we think about it, so is aging. None of us are getting younger, right? So there's going to be a need for most people to resume therapy periodically as we age to prevent, regression or at least to maintain our current level of independence, flexibility, strength, all of those things that go into balance. So like I said, we'll reevaluate you periodically and review the exercise progression and so on. We'll progress you to a home-based balance program once you're done with us. But we will schedule some regular follow-up visits just to reassess you from time to time. Our goal, though, is to progressively wean the patient off of therapy so that you are independent with your home workout. So the ongoing balance-based exercises, you can obviously do the things that we're going to teach you in our Age Strong program, but there are also other excellent things within the communities. So there are programs like Tai Chi for seniors, there's Silver Sneakers, look up local resources through your senior centers. And then the NCOA website is also good at finding some local programs and resources. So some of the things that we include in our program for that, continued fall prevention is we have a whole packet of information and literature. And one of the things that's included in it is this, how do I get up from a fall? Or what do I do if I fall? And so not only do we provide you with this handout, but we're going to make sure that we practice this with you until you get it right? So we're going to practice this numerous times. And what we have to do leading up to that, though, is make sure that you have enough strength to get up from the floor and then train you how to do it as safely and effectively as possible so that you're not injuring something else or falling again as you're trying to get up from the fall. The other thing that we'll give you is this handy dandy fall hazard checklist. And so you'll be able to kind of go through your home, either you or your family members, caregivers, and you go room by room and you check for things that might put you at risk for falling. So removing throw rugs, removing cords that might be in the way, making sure that you have adequate lighting, especially at night, like a night light. Um, and having either a cell phone handy or having some sort of call device is important too. So this checklist just helps you make sure that you've done what you can to minimize the risks or hazards within your home. And so kind of lastly, then with all of these things that we're talking about, if exercise could be packaged in a pill, it would be the single most widely prescribed and beneficial medicine in the nation. So this is from Robert Butler at the National Institute on Aging. And a lot of our information, in these slides is pulled from the NIA. But if you guys should have any questions, you can email me or you can go through Donna. She has all of our contact information. If you're interested in the program or you're having, issues with balance and falling, um, here is my email. I'm at Apex Network Physical Therapy. And so if you have any further questions, feel free to reach out to me or Donna, and we can go from there. I'll hand it back to Donna here.
Well, thank you very much. I'm trying to get my face on here. There I go. Oh, let me blur my black background. I hate when this thing does that. There we go. All righty. Well, thank you very much, Miss Beth Hall. That was great. A couple of questions here. One is, or even a comment actually, because that was some really, really good information, and I'm sure many people can benefit from the information that you just shared. One thing in particularly that actually stood out to me was when you did speak about ways of along with the fall risk. One thing I guess that just really comes to mind is that a lot of times you hear or you come across the elderly, just depending on how often they have somebody coming into their home. Sometimes when they're falling, they be on the floor laying there for hours, and
Yeah.
sometimes even days, just depending on when somebody's going to come in the home and check on them, or they have a caregiver or a family member, somebody that comes and periodically comes and check on them. Sometimes they're down for quite some time. So I think that is so awesome to know that you don't have to just lie there, and hopefully if we take these fall prevention methods, you don't even have to get down there at all. But things happen sometimes, like you say, things happen. And so just knowing that if it does happen, you have ways to kind of protect yourself, or to be able to not to have to stay down there so long. I
Exactly.
think
Yeah.
that was really good. I really like that. Thank you so much for sharing that information. I'm not sure if Lee have any questions or comments or concerns, but that was really, really informative. And so much so that I know when I do, and particularly I have to go to a client's house today for some paperwork and to meet. And she's the one I guess came in my mind because I know the first time I met her is just her and her dog at home, but she even has a caregiver that comes, I think, like, I want to say anywhere from 4 to 6 hours a day. And she has family members that come every single day um, on their way home, before they go home or whatever, just before the day ends, put it like that. Somebody comes to
Mhm.
her house. And so, with knowing that information now, because I know she told me she had laid there on her floor for hours, I think like until the next day or something,
Oh.
because she just her and her puppy. And she was like, I end up laying on the dog's bed, kind of scooting herself to get as comfortable as she could, and laying on the dog's, kind of little pillow thing to, help something to help support her head. But from that, she stayed in the hospital, I think she said like a month or something.
Oh,
So
wow.
I'm
Yeah.
like, gosh, it's just so much that can happen when those things occur. And it looks like, let's see here, Lee said, from a personal experience, I noticed more likely to fall after a fall. Yes. And I'm in my 30s. Hope people can use some of the techniques to help prevent falls from even happening. Yes, I agree with you, Lee. And that's what we're hoping for as well, that the information that was given today will help many people fall prevention, most definitely, because that's what we're after, helping people to stay healthy and strong as long as they can, you know? So, most definitely, that's something to take into account. And I'm even going to suggest, since I have to see this lady today, I'm going to suggest her getting on here on our page if she can't do it herself. Maybe somebody, maybe a caregiver, or one of her grandchildren that comes to see her, if they will help her actually read and listen to this information, because I think that'll be something that she most definitely can benefit from. Yes.
And
um
like I said, sometimes people think, oh, I can't do those activities, but kind of going back to what we talked about earlier, we start out at whatever level you're at,
there you
so
go.
it's not like we just jump into all of these really hard strengthening exercises or balance exercises. We come to you, we figure out where you're comfortable, and then we kind of build from there. And so it sometimes sounds intimidating to people to seek out help for it, for their falls or for their balance issues,
Yeah.
but it's not. And sometimes, they have pain also, and that's a barrier. I saw Lee ask if we offer other therapies, and absolutely we do. We do all kinds of pain management, from back pain to neck pain, knees, ankles, wherever you have pain, we treat it essentially. So that shouldn't be a barrier for seeking out care for your balance either. And we do lots of other things. So there's a technique. It's called blood flow restriction, and it's actually a way that we can help patients get stronger with low intensity training. And so,
Okay.
everybody thinks that, oh, I have to do this high intensity weightlifting and so on and so forth. And this is all body weight activated, essentially, where we use these little blood pressure cuffs on the extremity, so the arm or the leg, whatever we're trying to strengthen. And that helps us move into, it's called anaerobic strengthening, or anaerobic exercise, so that we produce strengthening about 3 times as fast as like high intensity training. So it's great for our patients who are a little older who can't do high intensity anymore. So lots of different things out there. There's uh, dry needling, which is similar to acupuncture for pain control. We have lots of different clinicians with all kinds of specialties who can help manage whatever your barriers are to seeking treatment. So don't don't say I can't do it because of this, that, or the other reason. Just do it, right? So get out there
Exactly.
and talk to a physical therapist. Like I said, hopefully it's us, doesn't have to be us. We just want you to be safe and get care. So
That's it. Absolutely. And I'm so glad you did share your information as well, so that I know I personally have your information, but others will be able to, because you never know sometimes if you yourself um, don't really at that moment in time have a need for it, but most of the time, either we know somebody, if not presently, in the future, and so that's why I said, and just so happened today you're on, and I'm going to see the very person who came to mind as you were speaking about. And I'm like, wow, I'm going to make sure I share this information with her, so that if it's a concern, falling is a concern for her, this is an opportunity or a way for her to be more educated to prevent it, and don't be afraid, like you say, because I think that's too is a big thing for a lot of people. Sometimes they're just afraid of just kind of stepping out, and receiving the help that they need. And we know sometimes, people can be kind of stuck in their own way. They're used to the way that they do things, and oh, I'm gonna be okay, and that's not going to happen to me until it happens, and once it
right.
happens, then we want to say, oh, I coulda, shoulda, woulda. But at that point, it's kind of too late for that instance at that moment. But it's not too late, for future opportunities or future times and things like that, because we don't want it to be a reoccurrence. And yeah, usually if you have one fall, you're prone to have another one, so do everything we possibly can to prevent that, for again, for people to stay healthy, and live a better, more prosperous life. And again, I
Absolutely.
just really, really, really appreciate you for this information. Um, wow, because even myself, I just kind of think about how as I'm getting up in age, I know one day I hit myself at the edge of my headboard because the way my bed frame is made. And when I hit myself like at the hip area, oh my gosh, it hurt so bad. And it ended up like, I'm like, oh my goodness, I hope I didn't have like a little fracture line or something in my, because it hurt, for several days after. And then finally it stopped. But, I just kind of think about things like that, it's little small things that you don't even think about, because that had my bones been a little bit more fragile, I I could have probably had a little, hairline fracture or just
Right.
a broken hip. Anything could have happened. So as we get older and age, yes, this is just many things we have to be concerned about. So yeah,
Yeah, because it
again,
takes one fall to, fall and break a hip or fall and hit your head and have a bleed of some sort. So yeah, one time can be the end of our independence.
I
So
know
it's serious stuff.
it
I
really
know
is.
I'm kind of stubborn. I don't know how you are, but I really don't like how other people do things sometimes. So I don't want other people taking care of me. So
Right.
I want to keep my independence. I'm not going to like how they do it.
Yes, yes. And I think that is how most of us are. We're like, I'm used to it. I've been getting along pretty good. So yeah, that's great. And what you say, Lee, she say once she had what is
I
hers?
lost it.
There it is. She said, once I had a patient who fell on their hip, pop, then they fall.
Yeah, and that's unfortunate because that's usually
Fell on their
due to
hip.
osteoporosis. So
Oh,
and
wow.
that's where, making sure you attend your regular annual visits with your provider, making sure that you ask for those bone density tests, and then if you find that you have poor bone density, taking the prescribed medications to help bolster your bone density because that can happen. It's not as frequent, but you can have, just you can be walking around and have the hip break and then you fall. So it doesn't have to be, the chicken or the egg, I guess. Either
Right.
either can happen. You're much more likely to fall and have a fracture than to have a fracture than fall. But I did just, to Lee's point, have a patient who that is what happened. Um, and so it's unfortunate because then sometimes even all your efforts to work on your balance and your strength
Yeah.
are a little bit thwarted by that. The other good part, though, about exercise and strengthening is I'm going to get all technical and geeky with you, but it's called Wolff's Law. And so Wolff's Law states that your bones will basically become more dense, your bones get stronger with weight-bearing activity. So it's super important for all of us, especially women. So women tend to be more osteoporotic than men, but it affects us all. And it doesn't even have to be just, a hip fracture. We can have spontaneous compression fractures in our spine too, which are super painful. So it can affect all parts of our body that osteoporosis can. So absolutely make sure that you're doing those screenings to avoid any of those types of scenarios. Um, and I apologize for the geek out for a second there on the
Oh no,
Wolff's
no,
Law.
no. That's good though. I mean, because it's still you're educating us, and we need to hear that because
Yeah,
everybody don't know about that. So I know myself personally, I had never heard of it. So thank you. Yeah, whatever information you have, educate us, help us.
right, right.
You'll be surprised, what people don't know. And I've been in the medical field for over 15 years and hadn't even really known much about what you just said. So yeah, I appreciate that though. Thank you very much. Lee, did you have any other questions or comments? Doesn't look like it.
All right.
All righty, Miss Beth. Well, again, we want to thank you very much for this time and opportunity to help educate us and help educate the community. And I'm sure many people will benefit most definitely from your information. And if we have anybody that wants to reach out, if they don't, get it off the screen, of course, they can always come to us and we will give them the information. And again, thank you very much for your time and attention trust today. Greatly appreciate it.
Well, thank you so much
You,
for having me. It was nice speaking with you both. So
you are
I
welcome.
sure we'll be in touch. So
Yes, ma'am.
all right.
You take care now. Have a good
You
day.
too.
Thank you.
Bye-bye.
Bye bye now.